2 minutes past 5, and this has been Heart Health Awareness Week. To tell us a bit about it, we've got Warren Maginn, who's going to tell us in particular about the benefits of omegas. Warren, thank you for your time.
Thank you, Peter.
Now, omega, perhaps we could define first, or tell us first what omegas are. We've heard about omega-3s and omega-6s and omega-9s. Can you sort of define what they are for us?
Right, sure, yeah. Just in a simple nutshell, I would say that there are different types of fats that exist in our diet and in nature, and they all behave a bit differently in our body, and we really need a balance. Balance is really the key. So when we are lacking in a couple of key ones, we tend to need them for health.
And we heard... Go on.
So omega-3 is the one that most people are needing in the current, modern diet and scenario.
And we hear about essential fatty acids. Does that mean that, they are essential, and also that the body can't sort of produce them within itself?
That's exactly right. So by essential, we mean we need them from the outside world, we need them from our diet, and our body needs them to function properly. So if they're not in our diet, our body isn't necessarily going to function as well as it could.
Now, this has been Heart Health Awareness Week. Are essential fatty acids or omega-3s mainly important for the heart, or do they have other functions as well?
Well, as probably many people are aware now, omega-3's become a bit of a buzzword, and so it seems like there's no system in the body that doesn't benefit from having some omega-3s. It is particularly relevant to the heart, but really there's no system. The immune system, the brain, the hair, skin and nails, we know a lot of systems that are all benefited from moderate doses of omega-3.
And any age? I mean, is there any age that we sort of need it more than another, like later on in life, or, very, very young children?
Right, that's a good question, because it's actually one of those rare cases where the sooner you start, the better, because there are some early stages of development that really require these, and we can actually see some of the differences as to whether we get them or not in those early stages. But it really becomes evident later in life where, the different disease states that are so common in our society really shows that deficit more acutely. But when we're young is really when the game begins, and we would do well to get our doses early.
And the fact that we don't get them, or the fact that we need them in supplements, if you like, why is that? Is our diet deficient? Why the sort of need in particular for supplementation?
Unfortunately, yes. Our diet is deficient. It's not something that we find in a lot of packaged and refined foods today. And so a lot of people aren't getting adequate supply. Another little issue there is that what they usually are getting is the omega-6. So whilst they are technically essential, we usually overrun with them. And as I mentioned earlier, balance is the key. So really omega-3 is all we need to supplement, and supplemental levels are required to balance against this abundance of omega-6 in our diet if we are to experience health.
And Warren, this is not sort of mumbo-jumbo. There's clinical scientific evidence to prove that omegas A are important, and B, that supplementation does work?
Yes, exactly. I mean, it's one of the most established areas of nutritional science, which is my field, and it's one of the most rock-solid areas of the literature today. We still see loads of studies rolling in different areas to look at some of the finer tunings of things, but as a general topic, it's become well established how important omega-3s are, and that's why that's filtered through to the public media today.
And how much? I mean, that's sometimes a bit of a vexed question, or the advertising sometimes can get one a bit confused. You hear some of that sort of saying you need 9 or 12 capsules a day. Well, it's a fairly onerous sort of task to be taking 9 or 12 capsules a day.
That's true. That is true, and hopefully it's not too technical to describe the active forms of omega-3, which are EPA and DHA. And I much prefer to speak to people in terms of those rather than capsules, because capsules actually vary greatly in their concentration of those key fatty acids, and they're the ones we really need. And so I would like to say that we would look to aim for about 500 milligrams to 1,000 milligrams of EPA and DHA combined from whatever supplement we're taking, if we're to experience at least maintenance levels, if not therapeutic benefits. And
is that sort of 500 sort of each, or does it matter what balance the EPA and the DHA come in?
That's a good question. There are, in the field of nutrition, some understandings as to which balance we may want in different scenarios, but as long as you have that total amount represented by both of those, you're usually fine from a general omega-3 perspective. Some people like to focus on EPA for anti-inflammatory effects, or others like to focus on DHA for, brain support. But in general, they work together, and as long as you're hitting that total amount, you will experience most of the benefits.
And that's fairly clearly labelled on most supplements?
It is labelled on a lot of supplements. The thing to be aware of when choosing a good supplement is that sometimes the amounts between labels appear similar, but the amount you actually absorb from your supplement varies quite wildly. So you really need to look for not only a high level of EPA and DHA, but you need to look for high absorbability and some proof of high absorbability, which tends to come from what's called the triglyceride form. And in that, we want to make sure that fatty acid is not oxidized, it's not unfresh, and so we should be able to taste it. It should taste good to us. And then from there, we would like to see some studies showing the purity of the product as well to make sure we had a good supplement.
And what about the purity factor? Because occasionally you hear about particularly fish, and the oceans aren't as clean as they used to be, and the impact that mercury can have. Have you got any thoughts about that?
Yeah, it's unfortunate but true. We are seeing an increased accumulation of various compounds, not just metals, but also fat-soluble pollutants and toxins building up in fish. And so we really do need to look for products that really exceed the standards, not just meet them, because there's really no safe levels of things like mercury, and it is becoming an increasing problem. And if we were to try and eat the amounts of fish that we would need to hit those therapeutic amounts of EPA and DHA, we would definitely be moving towards not only a contamination issue in some cases, but a sustainability issue too, which I think is something that's underspoken about today.
That's a good point. The ocean might get fished out. Warren, is there a way to make sure that fish oils are clean enough? Is there a process that gets the stuff that we don't want in them out?
There is processes. There are some very special processes that not only remove any contaminants that are present, but also make sure they keep the essential structure of the fats intact, so that it is something that doesn't give you digestive distress. You really shouldn't get, fishy reflux or any discomfort or unpalatable tastes from your fish oil, and it's actually quite rare to find a good fish oil that feels like a piece of salmon in terms of your digestion, and that's something you're going to get the most from.
And there's also, again, been a lot of talk in recent years, I guess, about krill compared to fish oil. Have you got any thoughts there?
With krill, there are definitely some concerns when it comes to sustainability. The next greatest concern with krill would be the cost. If EPA and DHA is the main therapeutic exercise we're going for here, we can actually do that much more efficiently and at a greater value point with a good quality fish oil. Now, what is sometimes done is we compare very low-quality fish oils with krill. But if we take into account the very high-quality fish oils that exist, since there is a massive range, we start to find the most valuable supplement on the shelf, in my opinion.
Now, I think you do work for Nordic Naturals, is that right?
I do. I came across Nordic Naturals a little while ago, a few years ago in my career, after realizing some of these falling down points with a lot of omega-3 supplements, after knowing my biochemistry and knowing that it was so important for us, but we really weren't getting something that gave me the clinical results or was easy or palatable to take. And I found Nordic Naturals was, and I sort of decided to peer behind the curtain, so to speak, to find what was involved there. And it really starts to hit these criteria of purity and freshness and absorbability. Having research done on it, they show a lot of ethics. You want to look for third-party analysis when it comes to purity. And so they were the only one that really met that for me. So I was prepared to put my name to those in my clinic. So
if someone was looking to either start supplementing or to take a supplement of omega-3 that you would recommend, Nordic Naturals is the way you'd be going?
Absolutely, far and away. And as I said, it's really something you want to look for third-party literature to prove that. Otherwise, the marketplace does look like a very, confusing and complicated space. We really just want to look to evidence, and the evidence is also a personal one. We should experiment with our products and see which feel the best. And you will notice that we really can't compare apples with apples. So
Nordic Naturals is NORDIC naturals.com.au. Well, what about in general terms for heart health? I mean, what sort of things can we do? Is there anything sort of new? I guess, the give up smoking, exercise, a bit of relaxation, fruit and veg. Is there sort of anything new as far as research goes?
I will tell you there's no magic pill, but you do mention some of the main factors there, and you do also mention relaxation. It's a very important one. Stress raises a lot of chemicals in the body, particularly to do with inflammation, and inflammation is the real concern when it comes to heart health, and that's where fish oil gives a lot of its benefits. It does calm and lower that inflammation, But there's lots of other things we can do to lower inflammation, like, as you say, eating our vegetables, a whole food diet. Exercise is fantastic. But really that sleep and relaxation is free and very powerful.
Terrific. Warren, good to talk to you. Hopefully we can talk to you again. Just repeating, the company that you're recommending in terms of omega-3s is Nordic Naturals, and people can get more information from the website nordicnaturals.com.au. Thank you for your time.
That's exactly right. Thanks, Peter.
That's Warren Maginn, who's a nutritionist, a scientist, and talking about the benefits of omega-3 in this Heart Health Awareness Week.